Rachelle. Thank you.
A pilot is lying in a hospital bed. He is in agony, bandaged from head to toe, totally unrecognisable. His nose and eyelids, gone. He is still young, yet he feels his life is over. I have great respect for the men and women who served in our wars. Many legendary names are remembered, not only by New Zealanders, but all over the world. Names like Cyril Bassett, Charles Upham, Keith Park, and more recently, Willie Apiata, are synonymous with our war history. These men, like the others who served, show determination, camaraderie, egalitarianism, and courage. Whether it be the shores of Gallipoli, the trenches of Passchendaele, the skies of Crete, or the mountains of Afghanistan, New Zealanders have a proud reputation of bravery, spirit, and valour. Today, I am looking at New Zealanders at war in a different context to the war heroes we usually honour. Someone not fighting in the trenches, defending the skies, or battling on the seas, but who still encountered the horrors of war firsthand. Armed, not with a gun, but a scalpel, this distinguished Kiwi pioneered techniques during World War II that are still used today. He was known as the boss, the maestro. He was a man of enormous compassion. He was a man of vision. He was brilliant. He was full of courage. He was a leader. Who is this man? Who is this amazing, inspirational Kiwi? Sir Archibald Hector Macindoe was born in Dunedin on the 4th of May 1900. He graduated from Otago Med School with high honours. He wanted to become more than just an ordinary doctor. In 1939, he gave up a successful private practice to become plastic surgeon for the RAF. He set up a plastic surgery ward at Queen Victoria Hospital, England, where he would deal with horrific injuries and aviation fuel burns that had never been seen before. Airmen were coming back faceless, often burnt beyond recognition. The burning fuel was utterly merciless. My cockpit became an inferno. Fear became blind terror, then agonised horror as the bare skin of my hand shriveled up like burnt parchment. The smell of my burning flesh was so disgusting, I wanted to vomit. During World War II, World War I, most patients with severe burns died within 24 hours due to infection and fluid loss. By World War II, improved plane design and safety gloves and goggles meant greater pilot survival rates, but Macindoe still faced huge challenges. He had no textbooks to refer to, no more experienced colleagues to consult with. Macindoe was the expert, learning on the job. The saying, war is the greatest school of surgery, certainly rang true. Between 1939 and 1945, Macindoe saw 5,000 burn patients and performed over 600 facial reconstructions. The most remarkable thing was that he didn't walk away. He didn't say, "Ugh, I need 60 more staff." He just got on with it. He threw away the military rulebook and replaced it with good Kiwi egalitarian practices. Ward 3 was like no other. All ranks were treated equally. Patients were allowed to wear their uniforms. He insisted on first names and made sure the nurses he hired were pretty, knowing that if the men were surrounded by pretty women, it would restore their confidence. Macindoe worked systematically, creating new eyelids and lips so the patient could at least eat and sleep. Then he would graft trunk-like tubes of skin called pedicles to create new noses, chins and ears. Tannic acid was used to treat burns and often caused excruciating pain, scarring, and even blindness. Macindoe was determined to find a better solution. He compared airmen who had crashed in the ocean to those who had crashed on land. They were in less pain, had cleaner burns, and the skin was easier to graft. He developed a soothing saltwater bath for his burn victims. Within a few months, McIndoe's saline bath had replaced tannic acid throughout the forces, and saline baths are still used as burns treatment today. Many servicemen struggled to fit back into society, but not McIndoe's patients. Not only did he heal their injuries, he healed their minds. He knew surgery was only part of the cure. The men's morale was very important too. They would be faced with many operations over several years, so he aimed to make their hospital stay the best it could be. McIndoe would often join his boys for a beer on the ward, and once they were better, take them out to the local pub. He organised dances, concerts and sporting events to combat the despair of disfigurement. He asked the locals to help. Talk to them. Take them into your homes. Treat them normally. McIndoe's patients became known as guinea pigs, as much experimental work was trialled on them. The Guinea Pig Club was formed as a support network for the 649 airmen who had suffered the worst burns and injuries, to help them readjust to their new lives. 8% of these brave men were New Zealanders. They said in order to be a guinea pig, you had to be boiled, mashed or fried. Remember the injured fighter pilot lying helpless in his hospital bed? Thanks to McIndoe, he would find the strength, find the will to survive. McIndoe would give him back his dignity, give him the courage to face the world again. The New Zealander who had dreamed of being more than just an ordinary doctor had done just that. He was held in great respect by his colleagues. He was a hero in the eyes of the men he treated. He made these men feel normal again. He rebuilt their faces and their futures. Sir Archibald Hector McIndoe is a true genius, a true hero, a true Kiwi. Thank you.